Today's question is, Doctors of Reddit, what is the biggest mistake you've made?
Doctor here. I don't think you're going to get a lot of responses. The average non-medical person just doesn't understand how certain things happen. And it seems egregious that Dana Carvey had a coronary bypass to the wrong artery, even though it's pretty damn hard to find a specific vessel at a specific location on the heart. I'm impressed this isn't a more common situation. Then, after an incident like that, people just think that the doctor should lose his license for that. Never mind that the physician may have spent 15 years in extremely rigorous training, went hundreds of thousands into debt, and has committed his life to the profession. My entire identity is partly wrapped into being a physician. That's like saying a parent who makes a serious parenting mistake should simply lose their children forever, and yes, I am a parent as well. Plus, there are patient privacy laws, non-disclosure arrangements from lawsuits, and a lot of other things. I think malpractice is a wholly flawed concept. A surgeon in the following specialties has a 99% chance of being sued in his career: neurosurgery, thoracic cardiovascular surgery, general surgery, orthopedic surgery, and plastic surgery. Source: if you think that 99% of surgeons deserve to be sued, then perhaps you should be the surgeon we all desperately need. Not me, but my mom. She just retired as an OB/GYN, and she told me about a time early on in her career when, while not a real medical mistake, she still almost ruined the operation. She was performing a C-section, I think, and she dropped her scalpel on the floor. Before she could think, she blurted out, "Oh shit," as a reaction. The mother, thinking something was wrong with the baby, started panicking. It took a team of nurses, the husband, and the mother of the patient to calm her down. As a very young doctor in training, I misdiagnosed a woman with epilepsy. Some years prior, she had sustained a gunshot wound to the frontal area, damaging the underside of one of her frontal lobes and severing an optic nerve to one of her eyes, as well as some of the muscles that rotated that eyeball. Surgery saved her life, but the frontal lobe was scarred, and the eye was blinded and always pointed down and at an angle away from her nose. A few years after that, she began having spells of a bizarre sensation, altered awareness, a pounding in the chest, and she had to sit down, stop what she was doing, and couldn't speak. These were odd spells, and I assumed she had developed frontal lobe epilepsy from the scar on her brain. Increasing doses of anti-seizure drugs seemed to work initially, but then the spells came back. A couple years after my diagnosis, her endocrinologist, who treated her for diabetes mellitus, checked a thyroid. It was super high. The spells were manifestations of hyperthyroidism. She drank the radioactive iodine cocktail, which ablated her thyroid, got on thyroid replacement therapy, and felt well thereafter. No permanent harm done, and she was able to come off the anti-epilepsy drugs. She was obese, not the typical skinny hyperthyroid patient, and if she developed thyroid eye disease, I couldn't tell because her one eye was already so messed up. I see how I screwed it up. But in retrospect, I have never been sure what I could have done differently, except test her thyroid at the outset of treatment. Hence, a lot of patients, thousands, have had their thyroid checked by me since then. Every so often I pick up an abnormality and it gets treated. The lady was an employee of the hospital where I trained, and I ran into her one day. She gave me a hug and let me know how this had all gone down. She made a point of wanting me to know she didn't blame me, because I always seemed to care about her and what happened to her. I think about her and how I screwed up her diagnosis and set back her care almost every day. I am a much better diagnostician now, but I always remember this case, and it reminds me not to get cocky or be too sure that my working diagnosis is correct. I'm a nurse, but I was working in the ER when a guy came in for a scratch on his neck and feeling drowsy. We start the usual workups, and this dude's blood pressure tanked. We scrambled, but he was dead within 10 minutes of walking through the door. Turns out the scratch was an exit wound of a .22 caliber rifle round. The guy didn't even know he'd been shot. When the coroner's report came back, we found that he'd been shot in the leg and the bullet tracked through his torso, shredding everything in between. There was really nothing we could have done, but that was a serious, what the fuck just happened moment? PharmD here. Couple different quick stories. Heard of a pharmacist who filled a fentanyl patch incorrectly, and the dose was so high that the patient went into severe respiratory depression and died. They're still practicing. Worked with another pharmacist back in the mid-2000s when I was still a tech who filled a script for Prozac solution. Concentrated it is 20 milligrams per ml. Average adult dose is 20 milligrams. Instead of 1 milliliter once daily, he filled it for 1 teaspoonful, 5 milliliters. The child got serotonin syndrome and almost died. He is no longer working to my knowledge. My grandmother has had diabetes for about 20 years and takes a handful of meds to help control it. About 10 years ago, she developed a persistent cough. It wasn't bad. She said it felt like a constant tickle in the back of her throat. She went to her doctor to find out what was going on, and he ordered a battery of tests concerned that she was developing pneumonia, lung cancer, etc. All the tests came back negative, so he prescribed a cocktail of pills to help combat it. Over the span of 5 years, she had tried about 35 different meds and none helped. One day when she went in for a routine checkup, her normal doc was out and she saw one of the on-call residents. He looked at the barrage of pills she was on and asked why. When she explained, he replied, "Oh, the cough is a side effect of this one particular drug you're on to regulate your insulin. If we change you to this other one, it will go away." Doctor here. I assume we mean medical errors and not general life decisions. No comment on life decisions. For medical error, I will not use a throwaway because I strongly think we should feel free to disclose our mistakes in order to improve quality and learn from each other. My first week of my intern year 1 outside of medical school, when you're on call overnight and all that, aka season 1 of Scrubs, everyone signs out their team's patients to the doctor on call overnight. So that doctor, in turn, with an upper-level resident also present overnight to supervise, is covering many patients they hardly know, maybe 60 or more. The situation was that a patient with dementia, unable to really communicate with people and clearly not there, but conscious, arrived from a nursing home with I think some agitation as the original complaint. Basic labs ordered in the ER show the kidney function is worse than usual, which could be due to many things. But what really must be distinguished is between not enough blood pumped forward to the kidneys and rest of the body, e.g. heart is failing and it's backing up into the lungs, vs. not enough liquid in the blood to flow, e.g. due to vomiting a lot or something. This is critical to distinguish because for the first you give medicine to make them pee out the extra liquid, and in the second you give more fluid. Either treatment for the opposite problem is catastrophic. Fortunately, it's usually easy to distinguish wet from dry. Based on listening to heart and lungs, chest x-ray, is there congestion evidence? Blood pressure and heart rate tend to drop BP and raise heart rate upon going from laying down to standing positions if you're too dry. Looking at neck veins while sitting up at an angle, they bulge if too wet, and so on. This patient was unable to cooperate with exam, answer questions, and the x-ray was sort of borderline, unchanged from the last x-ray maybe several weeks ago. My resident instructed me to sign out the patient with instructions to continue a 500 milliliter saline inflow, then reassess to see whether the patient looked more wet or less dry. I signed this out and forgot to make the order to stop the saline after 500 milliliters, so it ended up running slowly and all night. The intern on call, also first week as doctor, forgot to reassess at all or shut off the saline if it had been noticed because so busy with new admissions. We'd also ordered 3 sets of heart enzymes meant to diagnose a heart attack, one reason for a patient suddenly getting wet, i.e. heart pump failure, since the EKG was not interpretable, had a pacemaker which makes it impossible to tell. Lab fucked up too, because hospital policy was that if the first set of heart enzymes was negative, apparently the second and third sets, each traditionally spaced 6 to 8 hours later to catch a heart attack if it starts to evolve and become detectable by blood test, were both canceled. I came in and first thing in the morning checked on this patient, who was screaming things nobody could understand, and the nurses had chalked up to dementia and agitation. I checked the labs and saw the second and third heart enzymes hadn't been done. I went to the bedside and saw the 4 fluids still running. I immediately ran to the overnight intern, who said things had been so busy and nobody had called to notify that things were wrong. We stopped the fluids, immediately got a heart enzyme test, learned this patient was by now having a massive heart attack made much worse by the addition of 4 fluids all night to this frail failing pump. I can't get the screams out of my head, and cried a lot and was pretty depressed for a few weeks at least after this. The patient died because the status ended up being decided as not to resuscitate based on what the nursing home had on file, although no family members were known at all. This patient was totally alone and spent the last night of their life in physician-induced agony. But I acknowledge the failure of 2 interns, the nurses, and the lab. Ultimately, the blame fell on the lab and I think someone was fired, but I made clear to everyone that I felt to blame and wanted quality improvements made to prevent future errors, or at least catch them early if they happen. That's, I think, the best you can do when you make a mistake. There's a Scrubs episode where, as I recall, at the end there's a brief scene where the ghosts of dead patients representing medical errors follow around the physicians like little trains. It's very poignant, but I can't find the clip. That's what it's like though. And this is the end of today's video. I hope you liked it, and don't forget to comment an anecdote or experience similar to the topic of the video. Leave your like, share if you like the video, and lastly, don't forget to activate the little bell so you don't miss any of our daily videos. Bye-bye.